My talk at the World Cancer Congress was about results from the Delphi consensus process that we conducted among more than 60 stakeholders from 15 countries in Sub-Saharan Africa, with the aim to develop standardized indicators for monitoring and evaluation of cervical cancer screening programs for women living with HIV. As you know, in 2020, WHO published the global strategy to accelerate elimination of cervical cancer as a global public health problem. And in this strategy, they highlighted the importance of cost-effective interventions for cancer control. And these are HPV vaccination for girls, screening of women with high-performance tests, and appropriate and timely treatment for women who have been diagnosed with cervical disease. A year later, the Regional Committee of WHO for Africa developed a framework for implementation of this strategy, with aim to support these efforts and implement these interventions in their region. In our study, we developed and agreed on 17 indicators that can be used to improve monitoring for cervical cancer prevention and care activities that reflects the different domains of continuum of care, from prevention to screening, diagnosis, and follow-up. Our indicators focus specifically on women living with HIV, and for programs that had been integrated into HIV and AIDS clinics across Sub-Saharan Africa, but they can be adjusted and used in different settings as well. There are several challenges that should be addressed to eliminate cervical cancer as a public health problem in Africa. Firstly, the low access of preventive services, including HPV vaccination, is an urgent problem that must be addressed soon. We also know that there is a limited availability of screening programs, specifically in rural areas. And in addition, in African region, they still use low performance tests as VIA, or visual inspection with acetic acid, or pap smear, instead of high performance tests as HPV testing is. There are also high cost of treatment of precancerous lesions, for example. The majority of countries in Africa, they are using cryotherapy for treatment that requires gas and containers for gas, and sometimes this brings additional costs for facilities that should be addressed. A huge problem, not only in Africa, but everywhere in the world, is the lack of healthcare workforce, and specifically skilled workforce for cancer control and prevention, and also the lack of infrastructure for tertiary prevention. What that means, that woman, when she is diagnosed with cervical disease, she should be referred for further treatment and care. And lastly, what is the topic of my research, is a weak system for monitoring and evaluation. We definitely need timely and reliable data to use it and inform programs and policies in this region. In our study, we asked stakeholders to rate several times indicators on specific set of criteria. And at the end, we agreed on 17 indicators that reach consensus. And of these, 5 indicators reach consensus in all criteria they rated. Therefore, we will recommend these indicators to be implemented in a current cervical cancer programs that are integrated in HIV and AIDS clinics. I would like to thank our collaborators in African countries and our funders. My research has been supported by Swiss National Foundation and done in collaboration with International Epidemiology database to evaluate AIDS idea.